Hi, this is Dr. Toni Alvarado, and I want to welcome you back to the Harmonize Your Life Conversations on Self-Care for Women of Color podcast. We have a very good show for you today. Stay tuned and we'll be right back with our guests. Well, I'm glad to have with me today in the studio, in the podcast studio with me, Dr. Talaya Clark. I want to introduce her to you today, and I want to invite you into our podcast conversation. We're going to be talking today about self-care. We're going to be talking about nutrition. We're going to even talk a little bit about COVID-19 and how you and I can care for ourselves if we get COVID-19, or how we can keep ourselves from catching or being infected by COVID-19. I'm so glad to have Dr. Talaya Clark here for this conversation, and I'll share a little bit more about why I'm glad she's here. But let me read a little bit of her bio for you. So Dr. Talaya Clark graduated from Carnegie Mellon University with a Bachelor of Science in Chemical Engineering with a minor in biomedical engineering in 1991. Her passion and desire to help others was not satisfied until she went to medical school. She graduated from Medical College, Pennsylvania, Harmonize University, now Drexel University School of Medicine in Philadelphia, Pennsylvania. She did that in 2002. She finished her family medical residency program at Carolinas Medical Center, now known as the Atrium Health, in 2005. Dr. Clark has been working at Atrium Health Biddle Point Family Practice for the past 15 years, caring for the underserved population in the Charlotte, North Carolina area. Her special area of interest is mental health. And in 2019, Dr. Clark received the Atrium Health Tree of Life coin. This coin honors teammates who best embody their mission to improve health, elevate hope, and advance healing for all. For 8 years, she was the chairperson of the Health and Wellness Ministry at the New Covenant AME Church in Charlotte, and she has been a member of Mecklen Community Church since September 2015, and she works with the EMS ministry. Dr. Clark strives for good health in her own life by eating well-balanced meals daily and exercising with a personal trainer for the past 11 years. She started a running program in 2016 and ran her first 5K in December of 2016. One of her goals is to run a half marathon one day, and her free time is spent with her husband, Keith Clark, of 24 years, and her son, Matthew, who is 12 years old. Dr. Clark tries to educate people on common medical conditions wherever she goes, and how to improve their current health from where they are and within their current financial means. Thank you so much for being with us today, Dr. Talaya Clark. Welcome to the Harmonize Your Life podcast community.
Thank you for having me.
I'm glad to have you here. And so you all, I'm really glad to have Dr. Talaya here because we're going to kind of do a follow-up conversation. Dr. Talaya is also a part of the Harmonize Your Life Women's Self-Care Retreat. And we just got back from the retreat, and she shared in our retreat, and I wanted her to come and do a follow-up on the podcast to kind of talk a little bit and delve a little deeper into some of the things that we talked about recently at our Harmonize Your Life self-care retreat. I want to stop for a moment and invite you ladies, if you've never been to the Harmonize Your Life retreat, I'm telling you, it is a wonderful retreat. We do it every year in January at the beginning of the year. We do it so that we can set our year and set our self-care goals for the year and start our year out prioritizing ourselves, because we recognize as women, right, Dr. Talaya, if we don't prioritize us, no one else will, right?
Absolutely.
So we have been now, Dr. Talaya has been coming to the retreat for the past 2 or 3 years now. Was this your third year?
That was my third year, yes.
Yeah. So, that's right. So out of the 5 retreats that we have facilitated, Dr. Talaya has been to the past 3 retreats. And this year, I invited her to be one of our presenters in the retreat. And boy, did she bless us. I mean, she's so quiet and unassuming, and she's kind of shy a little bit, and we kind of pulling her out of her comfort zone. Me and Reverend Melanie Boone are pulling her out of her comfort zone and inviting her. I invited her to speak at the retreat, and then I told her I wanted to follow up on the podcast. And so she's here today, and we're going to do a little bit of a recap from the retreat, and then just delve a little deeper into some of the things that she discussed with us on in our retreat setting. It was a phenomenal time, and she did an awesome job. So Dr. Talaya, I want you to talk to us today a little bit about just say something to our podcast audience, introduce yourself and why you feel self-care is important, why this topic is important, what we're going to be discussing today about self-care, nutrition, and COVID-19 and how this all ties together.
Well, I think that women are the backbone of the family, they're the backbone of the community, and oftentimes we're giving, but we don't pour into ourselves. Mm-hmm. So this is a great opportunity to start at the beginning of the year to figure out how we can get ourselves back on track, since COVID-19, I'm finding, has sort of kind of had people go off track. So we want to get back on track with eating right and exercise. And I think as we feel better, then we can give better energy out and care for our families better. And oftentimes I do family medicine. So I take care of babies and children and adults and grandparents, the whole family. Mm-hmm. And I find that if the mom is not on track, the other family members are also sometimes not on track. If grandma's not on track, they're raising the grandkids, and then the grandkids are not on track. So when I see this, I'm looking at the total picture of the family. And if the family's not healthy, how can we have a healthy community? And that was one of the reasons why I chose family medicine, because I wanted to create that ripple effect. If I can help one healthy family, then I can help to create a better, healthy community. And so this is just a great way to start off the year to say, let's ladies get back on track, focus on yourself so you can then give better help to your kids. And that's one of the reasons why I think this is really important to start off the year right.
All right. And I'm glad you said that. So you said a whole lot in that little introduction. I'm telling you, you were dropping, as they say on Clubhouse, you were dropping some gems. And so, so I want to piggyback on a couple of things that you said. Okay. One of the things I heard you say is that in doing family practice and doing family medicine, you find that oftentimes it's the women in the family that set the tone for the health of the family.
Absolutely. I find that often. I mean, the women bring the kids in for the follow-up appointments, or they're in there themselves and they're talking about what's going on, how they're in the middle of the sandwich generation where they're trying to take care of their children, but they're also being a caregiver potentially for their parents in some kind of way. Sometimes now everybody's living all up in the same household, and how that impacts them mentally and physically. And then they're making sure the meals are getting for everybody else, but they're not eating themselves. They get the kids. Yeah. The kids got to be fed so they can get on to school. Then grandma got to eat because she got to take her medicines, and then they don't feed themselves, and then their health starts to decline, and they don't know why.
Wow. I mean, and I can testify. I think I shared this last week at the retreat when I was sharing with you all. And I said, at one point in my life when my children were smaller, I do everything by my Google Calendar. And so I had different colors for everybody in the house, for me, for Bishop, for the children. And I was like, girl, at one point I could have just quit and became a cruise activities director on a cruise ship, because I had everybody going. I had everybody's schedule. I had their different colors and all of that. And you're right. And even since we've been back from the retreat, one of the things that one of my goals when I came home from the retreat this week was always in January, I always set up all of my appointments for the year, all of my medical appointments, my physical, my mammogram, getting my thyroid levels checked, and all the things that are pertinent to me. But not only am I doing it for me, I set up Bishop's this past week. I set up Bishop's physical. I set up a dentist appointment for my daughter. You know what I'm saying? So we are the ones oftentimes making sure that our family go to their visits, that they don't miss these appointments, or that they do the things that they need to do to take care of themselves. Oftentimes, we're the ones cooking the meals. We're the ones doing the grocery shopping. We're the ones setting the tone. And it's my husband jokes sometimes because I don't eat red meat. And because I don't eat red meat, I don't buy red meat and I don't cook red meat. But my husband's like, every now and then he wants red meat. So usually if he's going to get red meat, it's because we went out to dinner somewhere and he's ordered a steak or something. But because I don't eat red meat, it's never really in the house. And that just goes to say, we set the tone a lot of times for what goes on in our house and with our family. And I appreciate you bringing that out. So with this whole idea of self-care, nutrition, and why that's important to us as women, particularly women of color. This podcast is dedicated now. While we are concerned about all women, I'm particularly have dedicated this podcast to women of color because I recognize, and in your bio, I read that you serve underserved communities, and oftentimes those underserved communities are people of color. They're people that look like you and I. They're brown people. And so oftentimes we live in food deserts. Yes. Our communities are food deserts. Sometimes we can't get the health care that we need in our communities. And we know from COVID-19, one of the things this pandemic has revealed is the health disparities in our communities and how monies are spent and things of that nature. And so you serve underserved communities, so I know you see this often.
Yes, and I totally agree. I love where I'm at because I have an opportunity to give back. I never thought I would be doing it, but I get so great enjoyment to give back to my own community. And I know where they're going through. I wasn't raised with a lot of money, so I do understand the importance of trying to take your money and stretch it. So when I'm talking to my patients, I try to give them healthy options within what I think are their probably financial means sometimes. Importance of fruits and vegetables. A lot of times they don't eat any fruit and they don't eat any vegetables. They can go all week. And I think that there's such a sadness because that's where we get all our fruits and our vitamins and things like that, and our minerals from eating the fruits and vegetables. And I sort of kind of tell them, even if you can't, the best way to know that you're eating healthy is staying on the outer edge of the grocery store, because that's where you have your healthy fruits and vegetables. And then also
on the outer edge. Say that again for our audience. So to eat healthy, you say stay on the outer edge of the grocery store. And I've heard that before.
Yeah, stay on the outer edge of the grocery store. And some people are like, what do you mean? Because when you first walk in the grocery store, that's where you have all your fruits, your fresh fruits, fresh vegetables. And then as you move around the side, then you have all your protein. That's your meats and stuff like that. And then as you move on down, then you have your milk. And then that's where you have your healthy dairy products and your cheese. And then you keep on down and around, and then you're out. If you're staying in between the aisles, getting a lot of canned fruits and canned vegetables and canned soups, that is not always extremely healthy, because a lot of times they have the high salt contents in the foods, and they don't understand that that's not really healthy. However, you have to look for the healthier options within that. That's what your means are. Let's take soup, for example. Soup, just choosing the healthy choice soup option, you will cut your salt in half, 50%. And people don't know if they have high blood pressure or have had other health issues, they need to look and pick the healthier hard soup options. And then the same thing with, I find a lot of my patients are trying to take money and stretch it. So they're eating oodles of noodles and things like that for the kids, especially now that all the kids are home. They're taking things that are quick for the kids while they're trying to be working. Here, go get your own lunch and things like that. But the oodles of noodles, it has 64% of all the salt you're allowed to have in one day.
Wow.
Now, that's an adult, and just one cup is 64% of all the salt you're supposed to have in one day. And that cup is only 35 cents. So if you don't have a lot of money, 35 cents and saying, I'm trying to feed my family, I'm trying to give my child some food or something, but that is based on an adult. And because I do family medicine, I find that the kids are eating adult portion size foods. And
Wow.
that is leading and is hurting their health. And the mom doesn't realize, because she's just trying to make ends meet and make sure she has food and make sure the kids have food. But that 1 cup is for an adult. It is not for a 7-year-old child.
Wow.
And so therefore, I have to educate the parents and say, you have to cut it in half, or you cut it 3/4, depending on what age the child is. So I try to learn more about it, so I make it in plain English so they will know what to do, because they're just doing it without knowing. They don't have the knowledge base that they need. And so I just take them where they are and then try to help move forward. And the same thing with the older people. They're maybe home by themselves, and so they get quick fix items that they can put in the microwave or microwavable dinners. But you also have to look at the salt content in the microwavable dinners, because some of them can be higher in salt. So anything that's sort of kind of like a Chinese food-based microwavable dinner is going to have more salt in it, because they're using soy sauce, and soy sauce is high in salt. So if you use it at the house, you always want to buy the low salt soy sauce item. That will help.
Wow. So it sounds like salt is the enemy.
Salt is the enemy, because too much salt in your diet will give you high blood pressure and increase your risk for heart disease, which is the #1 killer in America.
Wow. Wow. So salt is the enemy. And then sugar is the enemy too, right?
Yes, sugar is the next enemy that we have to fight. Oftentimes we're eating too much pasta or too much rice and too much carbs. And then some people are not eating the whole grain breads and stuff like that.
Okay.
So they're not switching over, even though they know it's right. They say, oh, doc, it doesn't taste right, so I just don't eat that. Or they're eating too many sandwiches. Sandwiches are quick. Once again, the sandwiches are quick for themselves and quick for their children, but they're 2 slices of bread. And if you're doing white bread, then you don't get the whole grains that you need.
Right, right.
Switch over to the wheat bread, then you're adding a little bit more fiber in your diet, which is going to help control your blood sugars. So it is important to switch over to the whole grain breads and the whole grain pastas and rice. But the whole grain rice takes longer to cook. And so some people don't want to take and plan their meals ahead of time so that they can have better nutrition. With the soap, and then also we drink a lot of sugary drinks. It's all about money for the industry, and I understand that, but it's a detriment to our health. Just drinking so much soda, it has a lot of added sugars in it, and that is also affecting our overall health, and that's contributing to the diabetes, because we're just drinking too many sugary drinks like soda, sweet tea, fruit juice, and Gatorade. Because the sport drinks, I find a lot of people say, oh, doc, I'm not drinking water. I switched from soda to Gatorade. I was like, okay, that's good. But Gatorade also has sugar, and Gatorade has sodium in it. So you didn't realize that just making that same switch, now you're adding more salt to your diet, because that was meant to replenish if you went out exercising and you were sweating, or if you had diarrhea or vomiting. It was meant to be used for that purpose. It wasn't meant to just have something more tasteful to drink. And I find a lot of people switch over from soda to Gatorade just because they want a taste of something different than water, because they say water doesn't have a taste. So I recommend just using the water and adding Crystal Light or one of those other little small packages, and that a different taste, but you're only adding 5 calories. You're not adding all that added sugar. And then when I was researching for the COVID-19, they were talking about the sodas have a lot of sugar in it. And when you have too much sugar, it decreases your immune system. So now you're opening yourself up that you're not going to be able to fight off the germs. And that can last for about 5 hours after you have a sugary drink like a
Wait a minute. So after a sugary drink, up to 5 hours after you drink a sugary, after we drink a sugary drink, I don't drink sugary drinks.
Right.
But after a sugary drink, up to 5 hours
afterwards, your immune
system has been suppressed.
Correct.
For 5 hours, which leaves me open 5 hours to infection or whatever.
Correct.
Wow.
And I mean,
this is stuff that this is why education is so important. And one of the reasons I bring this podcast and this information to you all is because we perish. The Bible says people perish for the lack of knowledge. And so I really, want our community to hear this information, learn this information, hopefully change our lifestyle and our practices so that we can live longer and healthier lives. I never knew that drinking one sugary drink lowers your immune system for 5 hours.
I didn't know either until I had to prepare for the talk for the retreat. I was like, oh, okay. That's why they say don't have a lot of carbonated beverages, because of the added sugar. Yeah. And so they just encourage you to drink a lot of water and drink green tea. And green tea is a good antioxidant. Right. So the more water you drink, flushing out your immune system, you're flushing out those toxins, you're helping to build better cells, because your body is made up of 90% water. So the more water you drink, it's really, really important. And I find oftentimes people don't drink but maybe 1 or 2 bottles of water per day, when ideally you should be at least 64 ounces, which is about 4 to 5 bottles of water per day.
I got my water cup right here. Got my water cup, and I got one of those cups that it's a big old jug thing. And so what I like to do is I like to drink out of my Yeti. Okay. And I keep room temperature, and I put lemon in it, and then I fill it up throughout the day. But I use the big jug with the 64 ounces, and it has like little messages on it as the water's going down. You can do it. You got it.
I think that's very helpful. I think people need to be motivated. So we have to find tools that's going to self-motivate ourselves, because and I tell people, like what you're saying, that water jug, that's your accountability partner. If you see that sitting on your desk and it's still up high, it's like, okay, I gotta
get my water in.
I gotta get motivated. Let me drink some more water before I do this next activity. But it's a great accountability partner. And I tell people the same thing about the scale. The scale is not your enemy. It is your accountability partner. So you can check yourself. Am I going up or am I going down? Don't wait to show up at the doctor's office and we tell you you gained 25 pounds. You need to know you're gaining pounds, because your clothes may fit the same, because the clothes are the clothes. We're wearing more sweatpants and things that are loose fitting because we're all at home. So we don't know we're gaining small amounts of weight. So these are items that motivate yourself and keep yourself focused and keep yourself on a good path of healthy living.
I wrote down your scale is your accountability partner. I'm taking notes as you're talking. Yes. And then you also said that having things like water jugs and things like that things tools that can encourage you.
Right. And then also knowing what size water jug you're drinking. So I use a 30-ounce water jug. So I know if I get 3 of those in all day, I've gotten my 90 ounces in. I do 1 for breakfast in the morning. I do 1 midday and then 1 at dinner. Those 3 are 90 ounces. That gives me my 90 ounces. So I know I'm on target. And it's also, some studies show that if you can drink half your body weight in water, it will help with weight loss. So I found that out when I was doing my weight loss journey. So it was a way for me to stay on track. And so you just have to find what works for you.
And I know drinking water is so important. I had Dr. Valerie Bridgman on earlier this month, and she talked about how she lost 50 pounds last year. Yes. And she said that, she drank a lot of water and she walked every day, and she saw the pounds come off. And of course, she changed her eating habits as well, her portion control and all of that. And she actually, her doctor wanted to put her on medicine for diabetes, but after she started doing this, her A1C level went back down, and she was able to avoid going on medication for diabetes because of drinking water and walking and portion control.
And I think those are the keys. You said it all. Those 3 are the keys. But the key part about her, when I listened to her story, was she was motivated. We have to be motivated. And once you get the motivation, then you can seek the knowledge. because you can have all the knowledge in the world, and I'll tell my patients, oh, to do this, and they say, oh yeah, I know that, but they don't do anything with the information. The key with her is you have the motivation, then you add the knowledge, and then that will lead to success.
Oh, wait a minute. You just gave us a 3-pointer here. You said motivation
plus knowledge
equals success.
Yes.
So it's not just good enough to know. And that is so true, because most of us know what to do.
Yes.
It's not that we don't know. If we would do what we know, you know what I mean?
Right.
We know. So it's the motivation plus the knowledge that equals success. I love that.
And for some
motivation plus knowledge equals success. Good.
Okay. And there are some people who don't know. So they don't have the knowledge, but they want to do better, but they don't know what to do. So now you have those people who are motivated, and then the doctor or people in their lives have to teach them how to have the knowledge so they can become successful. And I think that's all. It's a combination of both. And I think that's how we can help the community be better. With food, like we were talking about on the retreat, food can either stop the prevention of disease if you do it consistently early, or it can reverse the disease. And in her case, she reversed the disease by changing her lifestyle. So with the diabetes, she, you can start with her example. She had diabetes, which means that her blood sugars were too high in her bloodstream. So she chose to change her diet. One way to change your diet with diabetes is to think about your plate. And you want to have more vegetables on your plate than you're going to have carbs. Where a lot of times when I talk to my patients, they're eating a meat and potatoes diet. They have meat and some type of carbs. That's all they're eating. They're not having healthy vegetables, and they're not eating the fruits. And if you add in the fruit is a natural sugar. Oftentimes, with people who have diabetes, they think, oh, I can't eat any fruit, doc. I can't eat this. I can't eat that. It's not that you can't eat it. You can, but you have to choose the correct options. A lot of people love oranges, and they will sit there and eat a lot of oranges. But if your blood sugar is high, that is not the correct fruit that you should eat. But you can eat blueberries, you can eat strawberries, because the sugar content, which is natural, is a lot lower in those foods than it is with watermelon or like the oranges. So you can have fruit, you just have to know which fruit is better. And then the same thing with vegetables. Having more vegetables is going to help you stay full longer. And a lot of people don't eat the vegetables, so they feel like they're constantly hungry. So when they're constantly hungry, then they go back to snacking. And when they're snacking, they have a tendency to eat things that are high carbs. So they go for the chips and the potatoes or the ice, or they go for something else. When you eat those types of foods, they're not whole grains. So therefore, it spikes your blood sugars up high. And then once it gets out of your system, it drops out. And now you're hungry again. And now you're going back to eating more carbs. But if you have a whole piece of fruit in the middle of the day, along with some cheese sticks, that will help you stay full. And you will not be looking for the next snack. So I think it's a matter of learning how to combine foods. And people don't understand that protein is really, really important in your diet. It helps to satisfy your hunger. So if you don't eat enough protein, then you're still going to be hungry. And a lot of people don't eat breakfast. Don't eat breakfast.
Listen, it sets your day. Breakfast sets your day. It's the foundation. I tell everybody, and I hear people saying that to me all the time. I don't eat breakfast. What? No, I eat breakfast every day. Every day. I eat breakfast.
And your mama wouldn't send you out. You don't, as a mom, you don't send your child to school without feeding them. You give them breakfast. So we have to have the same kind of care for ourselves to know that breakfast is just important. And it's not just a cup of coffee, because a cup of coffee is good and it's not food. You need to have some protein and carbs. And a great breakfast is oatmeal. Oatmeal has complex carbs and it has protein. So you'll feel full longer, and that's better than having a bagel, because a bagel is just all carbs and it's not going to last long. And you're going to be hungry 2 hours later.
Wow. So y'all see why I invited her to the podcast? Do you see why I had her teach at the Harmonize Your Life Women's Self-Care Retreat? She did an awesome job at the retreat, and she has given us a whole lot of information today. And I wanted to make sure we kind of circle back to Leah. Yes. You at the retreat, you talked to us about 10 diseases affecting African American women.
Yes.
And you related to our diet.
Yes.
Can you talk to us about those 10 diseases?
So the top 10 diseases that affect African Americans are heart disease, stroke, diabetes, breast cancer, cervical cancer, fibroids, sickle cell disease, mental health, preterm delivery, and then also sexually transmitted disease. Now, the first 5 that I mentioned were basically heart disease, stroke, diabetes, and cancers. They are primarily related to our diet. If we need to follow a low salt, low fat, low carb, high protein, high fiber diet, then we can either prevent these diseases from coming, or we can reverse them if we get them. And that's why the nutritional piece of just following those 5 key points, when you really look at your diet day in and day out, do you have most of these things going on? It will help to prevent some of those diseases.
Okay, so say that again, the kind of diet we need to prevent heart disease, stroke.
Heart disease, stroke, diabetes, and cancer. You need to follow a low salt. That's what we're talking about. No oodles of meat, no rice-a-roni, and prepackaged meals. You need to follow a low fat diet. So meaning you don't want to eat a lot of fried foods. You want to eat things like salmon and healthy, use olive oil and those types of items. You want to follow a low carb diet. That's what we was talking about, the diabetic diet, not eating enough carbs. And then you want to eat a high protein. Those are the lean pieces of meat that you can have, or you can do more a plant-based diet or a vegan diet where you're doing mostly beans and tofu, and that's the high protein, because protein will eventually turn into sugar in your body as it breaks down, and then you'll still be healthy and have your energy food. And then the last thing is fiber. Fiber comes from mostly fruits and vegetables, and we encourage people to have about 2 cups of fruit and 2 cups of vegetables per day. And that will increase your fiber in your diet. The average American diet only has 10 grams of fiber, when the typical woman needs about 25 grams of fiber per day. So we are often not getting the fiber we need, and then we're still being hungry.
Wow. So Dr. Talaya, what do you say to someone who's listening to this and this all sounds so overwhelming? Maybe they have diabetes or have had a stroke or heart disease or different kind of cancers. What do you say to them? How can someone get on board with this? How can we turn around if we're going in the wrong direction where our nutrition is concerned?
I think one is obviously start working with your doctor. Start there first. Ask for information. Sometimes they can refer you to a nutritionist. And if you go to a nutritionist, the nutrition can do sort of kind of one-on-one counseling. And I think sometimes that's what some people need. But you need to start with your doctor first. And then the internet has a lot of information. And so you can create your own meal plan. Sometimes you see great recipes in the stores. It's like, oh, I should try that. Sometimes we just have to start with one meal at a time, or one dish that we really like. Try to figure out how can we take one of our favorite dishes and make it more healthy. If you can start there, you're doing one step at a time.
Okay, so one step at a time, starting with your doctor, getting some counsel there, maybe even talking to a nutritionist. Yes. Or someone that can help you with that. Now, you serve underserved communities, right? So are there any free programs out there, any community-based programs that people can tap into that you know of?
Not that I know of consistently. And because I serve Charlotte, and then we have different programs within our own hospital system that we utilize. But sometimes you can just utilize things as farmers markets or the SNAP program. As the SNAP program, as we're hearing more about during the COVID-19, they're trying to add more fruits and vegetables, or trying to find ways to have people who don't have to really gear them to have better food on the SNAP program and access. But I think that's one thing that people do have access to if they need to try to learn better.
The SNAP program. And then doing things like listening to this podcast where you're getting information. All you got to do is listen. All you got to do is click the link, listen. All you got to do is go to Spotify, Apple, go to Google's. You can download this podcast episode. You can go to my YouTube channel at Dr. Toni G. Alvarado. And the podcast is always uploaded there in video form. And so they're free. There is information out there. There's information there's free information that you can get from professionals like Dr. Talaya Clark and others who have given their lives to serving underserved communities and making sure this information is available for our communities. So I'm grateful. Dr. Talaya, you had your own experience with COVID-19.
Yes.
And so I want you to share a little bit of that with us, and then talk to you talked to us at the retreat about a little bit about your experience with it. And then you also share with us a COVID-19 kit that we need to all have in our home. So I want you to talk to us a little bit about it, your experience with COVID, and some things that we can do to mitigate catching it, or if we do, how we can overcome it.
So my husband and I, we both work in the healthcare field. My husband is in the nursing field, and so he works on a COVID-19 floor and has been most of the year. And so that's how he was exposed. And then I was exposed by being with him at home. For me, it was not much of a problem. I felt like I just had like cold-like symptoms, headache, cough, runny nose, maybe a mild fever. For my husband, he was sicker. He became more sick. So he had longer fevers, body aches, and he also wound up developing pneumonia. So he had to be hospitalized for 4 days. And then he was able to come back home. So COVID-19 is affecting people in different ways. And I think that it's something that we don't know enough about. And as we kept getting more information, we became more aware. And the reason why it's affecting the African-American community more was because we were already having all these underlying health conditions that I just discussed. And so therefore our immune system, once again, is not as strong as a person who maybe had no medical problems. So that's why it was affecting us. When we think about what we can do to help make our immune system nice and strong, some of the things that we can do is make sure we're eating healthy, as we talked about. We can exercise, and just going out and just taking a walk. A lot of people are not doing anything, but they're just sitting on the couch. They just have to get up and take those extra steps while they're watching TV, on the commercial breaks. Do anything to get up and get those steps in and get some exercise in.
Move your body. Yeah.
Move your body. And then even if something is getting outside and getting fresh air, that helps you to take deep breaths, and that fresh air really can help improve your immune system. And sleep. A lot of people are not sleeping well during the pandemic because their schedules for work change, and that's going to decrease your immune system. If you don't rest well, then you open yourself up for increased infections. So we definitely recommend trying to get 7 hours of sleep, trying not to drink a lot of alcohol or caffeinated products, and then trying not to smoke. All of things are really important, and reduce your stress. You just have to find a way that you can reduce your stress. One thing I did bring up is that there are some vitamins you can keep on hand. So if you do get sick, to try to start these things.
Now, is this your COVID-19 emergency kit?
Right.
So yeah, because I want them to know what you called it at the retreat, and we love that. And you actually gave one away. Yes. So, and I was jealous because I didn't get one, but that's okay. That's okay. I went to Walgreens when I got home.
Okay. So you had all those things in your house anyway.
Yeah, I did. I have most of it. I did. So tell us the thing. But the one thing I didn't have was that machine. I don't have that machine. I need to go get that. Okay, so tell us about the COVID-19 emergency kit that you told us about at the retreat.
The COVID-19 emergency kit is vitamin C, because that will help boost your immune system. You want to have zinc. Studies show that starting zinc at the beginning of any symptoms will decrease the length of time that you could be sick. So you have vitamin C, you're going to have zinc, and then you're going to have vitamin D, D as in David. That will help regulate your immune system. So those are the 3 vitamins you want to keep on hand. And then you want to have, obviously, a thermometer at home so you can check your temperature. And the last thing that some people may not have is called a pulse ox machine.
That's the one. That's the one that I didn't have. I have a thermometer and I have the vitamin C, and I need to go get the zinc and the vitamin D though.
Okay.
But then you said the pulse ox.
It's called a pulse ox machine. You can get them at Walgreens or any drugstore. It's just a little probe that you would put on your finger when you go to the doctor's offices, and you just prop it on your finger, and it's to let you know how your oxygen level is doing in your body.
Okay.
And sometimes people were just tired, and then their oxygen level was going down with the COVID-19. And if you had that available, you can know yourself, am I in danger? What's going on with my body? If my oxygen level is just not doing well, even though I don't feel short of breath, my oxygen level is going down. So those are those 5 basic items that you can keep at home and have it ready just in case you develop COVID-19. But hopefully with good wearing your mask, hand washing, and staying socially distanced, you won't get the virus. And then the next piece of the puzzle is making sure you get your vaccine when it's available. I've gotten my first shot already, and now I'm going to get my second part of the vaccine this week. I think it's really important that we talk to our families and friends about really getting the COVID-19 virus vaccine, because the vaccine is going to help us hopefully get back to normal interactions with people and understanding what the vaccine will do. A lot of people in our community are hesitant with the Black and brown about getting the vaccine because they're concerned about, is it healthy? Is it right? Studies did show that they tried to test the vaccine on 9% of African Americans. So we were in the vaccine early treatment process. And I think that that's important to know, because we may respond differently to vaccines, medications, and drugs than someone else did. The overall community is like 11% African American. They were able to get 9% of the study members to be African Americans. So I think they've made the effort. And now we just have to do our part by getting the vaccine. And then talking to other people and encouraging a friend or a neighbor to get the vaccine. And hopefully they will become easily available. The vaccine itself, the goal, some people have asked me questions about the COVID-19 vaccine and what will it do. The goal of the vaccine is to hopefully decrease the harm that's doing to your body. So hopefully you won't have to be hospitalized. Even if you still could be exposed to the COVID-19 virus even after you get the vaccine, but hopefully your symptoms won't be so bad that you won't have to get hospitalized. And that's why we're encouraging people to get the COVID-19 vaccine. It's very similar to the flu shot. The flu shot, once you get the flu shot 2 or 3 weeks later, your body responds and creates antibodies to protect yourself. You still could be exposed to the flu, but hopefully your symptoms will not be extremely severe. And that's why we encourage people to get the flu shot. As we've talked before, vitamin C is really important with the immune system. And there are certain foods that have vitamin C that we can continue to eat during this time, such as the oranges and the lemons, grapefruit, broccoli, and kale. As we continue to eat these foods, we will naturally improve our immune system. If you do get sick, it's really important to double up on your water intake and your herbal teas. You want to hydrate yourself. And then also you want to drink broth. If you get sick immediately within those first 24 hours, you want to get water, you want to get broth, you want to increase your vitamin C, you want to get plenty of sleep. Just rest. Really, really take the time to really, really rest and not try to do a lot of things. And then also you want to start that zinc. And those are things that you want to do immediately as you start to get sick.
Okay. Good. Thank you, Dr. Talaya. You have been such a blessing to the Harmonize Your Life community, the self-care community. Thank you. She's also, Dr. Talaya is also a part of the Harmonize Your Life Women's Self-Care Network. These are some of the women that are in our network. If you're not a part of the network, you are missing out on a movement. We have started a self-care movement for women of color. We are on the move. We are taking care of ourselves, and we are taking care of our community. So I want to make sure that you are connected to the Harmonize Your Life community. I want to make sure that you are connected to people like Dr. Talaya Clark and myself and other women who have been a part of this podcast and our community. Listen, I want you to look up Dr. Talaya if you're in the North Carolina area and you're looking for a good family practitioner, internal medicine doctor. She is the one. And you can find her at the Atrium Health Biddle Point Family Practice there in Charlotte, North Carolina. She will be a blessing to your life. You can go there to their website at atriumhealth.org and look her up. And I know that she will be a blessing to you and your family. Again, I want to thank you, Dr. Talaya, for coming on the podcast today and being one of our guests for the month of January to kick off this year 2021 and help us reset our year, taking better care of ourselves. And we are so grateful to be connected to women like you. All right. Thank you again. Thank you. Thank you. Thank you. Listen, follow us next week. Be a part of the Harmonize Your Life podcast. Tell a neighbor, tell a friend about the podcast. Follow the podcast, share the podcast. You can download it, keep it with you, and share it with others so that not only can you be healthy, but that we can be a healthy community. I'll see you on next week. Hi, this is Dr. Toni Alvarado. I am so delighted about bringing the Harmonize Your Life podcast to you. Would you do me a favor? If you are enjoying this podcast, would you email me at hello@drtonyalvarado.com? I want to hear from you. I want your feedback. I want to know if there are any other topics that you are interested in as it relates to wellness, self-care, nutrition, or just overall bringing harmony into your life. Email me, contact me at hello@drtonyalvarado.com.